Greetings from Bavaria. After the Surgeon General's visit here, I was contacted about making a short video about the operating company model and how it is being applied at our MTF. Like so many AMED organizations, we live and work in an active operating company model every day. The operating company model has similarities to what we know in Army speak as mission command. But an operating company model is far more than this. The Surgeon General's goal is to employ the tenets of the operating company model to boldly move Army medicine along a deliberate path during a period of significant turmoil. The focus is on clearer guidance, better clinical outcomes, more accountability, and improved impact in the life space of our patients. In healthcare, good business practices and safe and effective medical care are natural partners, and data suggests this to be true. I offer my understanding of the operating company model and how we use it in this locale. Standardization. Does this mean cookie-cutter medicine? Of course not. Standardization of our RDP process has proven hugely successful, and safer healthcare is the end result. What has changed is the removal of unwanted and unsafe variants. All of our 7 clinics run slightly modified versions of the RDP. Each is tailored to the local population, space available, relationship with the local units, etc. But all perform several key elements of the RDP, which are always done in the same manner. Standardization also requires that we share effective best practices rapidly and deliberately. Accountability. An operating company cannot function without it. In Army medicine, better accountability is essential for us to continue enhancing health services to the 1.8 million beneficiaries we regularly care for. And as the current conflict scales down, we need to sustain our hard-earned clinical skills honed by the sacrifices of so many of our AMED soldiers. We use performance objectives. We use them to ensure that no one is unsure about what we are trying to accomplish. It also helps keep subordinate leaders focused on core medal tasks. Access was a real issue for us. I simply told the clinic commanders what the goals were and how I was going to measure them. Each went about it a little differently, and some engaged earlier than others, but the aggregate result was an 11% increase in access. Leaders at numerous levels began asking similar questions of their staff. The basic formula has always applied. Where are your people and what are they doing? The yield? Greater adherence towards aggregate strategic goals. The operating company model will allow us to better align our resources with our strategic goals and objectives. An operating company looks much harder and less emotionally at the data. Questions such as, what is the right scope of services we should offer at each location? Where can we best ensure clinical wartime skill sustainment for our MedCom soldiers? All these should be answered with data and facts. Ultimately, by embracing the tenets of an operating company model and supporting TSG's express vision, we have an unprecedented opportunity to simultaneously A. sustain hard-earned wartime clinical skills, B. be better stewards of the government dollar by running more effective medical operations, and C. positively impact the life space of our beneficiaries. This is our opportunity to create the new path towards excellence for Army medicine.